Are you wondering whether atorvastatin is the right medication for you? This medication does have some side effects that are concerning, especially in older adults. This video will examine the drug atorvastatin, educate about side effects, and tell you what warning signs to look out for, which are potentially deadly. Welcome to Thinker Health. On this channel, we'll give you tips and advice as well as educate you about health-related medical concepts to promote healthy aging. And if you're new here, consider subscribing. Next, we are going to look at the 10 most common questions regarding atorvastatin, including the drug's most common side effects. So the first question is, what is atorvastatin? Atorvastatin is a lipid-lowering drug to lower cholesterol. Your body makes a wax-like, fat-like substance called cholesterol in your liver. Triglycerides, another fat, is also made in your liver. They are also found in foods. You need some cholesterol for good health, but too much is not good for you. Cholesterol and triglycerides can clog your blood vessels and make it hard for your blood to get to your heart. It is especially important to lower your cholesterol if you have heart disease or diabetes. Atorvastatin is used together with your diet to lower blood levels of bad cholesterol, also called LDL, to increase levels of good cholesterol, also called HDL, and to lower triglycerides, which is another type of fat found in your blood. Why is my doctor recommending atorvastatin? Atorvastatin is used to treat high cholesterol and to lower the risk of stroke, heart attack, or other heart complications in people with type 2 diabetes and coronary heart disease. It is also used to slow the progression of heart disease as well as renal disease. Atorvastatin takes a couple of weeks to take effect. So how does it work? How does atorvastatin work? Atorvastatin belongs to the family of medications called statins. They are also called HMG-CoA reductase inhibitors. They work by blocking the production of cholesterol in the liver by the enzyme HMG-CoA reductase. How should I take atorvastatin? Atorvastatin comes as a tablet, so you can take it by mouth, and it comes in the following doses: 10 milligrams, 20 milligrams, 40 milligrams, and 80 milligrams. And it should be usually taken once a day with food or without food, but take atorvastatin usually around the same time every day. And the reason is atorvastatin is usually given at nighttime because the cholesterol making enzyme is more active at night. Also, the half-life, or the amount of time it takes for half the dose to leave your body of some statins, is short. If you're unable to take the dose at nighttime, stick to taking the medication at least at the same time every day. What happens if I miss a dose? Use the drug as soon as you can. However, if you're more than 12 hours late for the dose, skip the dose and go back to the normal time you take the drug. Do not use 2 doses at one time. What should I avoid while taking atorvastatin? Avoid eating foods high in fat or cholesterol, or atorvastatin will not be as effective. And avoid drinking alcohol. It can raise triglycerides and may increase your risk of liver damage. Grapefruit may interact with atorvastatin and lead to unwanted side effects. Grapefruit contains a chemical that interferes with your body's ability to break down or metabolize certain statin medications. When statin takers eat large amounts of grapefruit, the levels of statins in their blood can increase, raising the possibility of side effects. If you're finding value in this video, go ahead and give it a thumbs up and hit the subscribe button. So what other drugs can affect atorvastatin? The following drugs can interact with atorvastatin. However, this list is not exhaustive, so please talk to your doctor or pharmacist to see what is the right choice for you. Diltiazem, which is a heart medication. Gemfibrozil, which is a medication to lower your triglycerides. Antibiotics such as clarithromycin or erythromycin. Antifungal medications such as fluconazole. HIV medications, medicines that contain niacin, drugs that can weaken your immune system such as steroids, cancer medications, or medications used to prevent organ transplant rejection, such as cyclosporin, oral contraceptives, antacids, supplements such as St. John's wort or red yeast rice. Who should absolutely not take this medication? You should not use atorvastatin if you're allergic to it, or if you have liver disease, or if you're pregnant or breastfeeding. This medication can cause birth defects or harm the unborn baby. So do not use it if you're pregnant. Stop taking atorvastatin and tell your doctor right away if you become pregnant. Tell your doctor if you ever had any of these problems before taking atorvastatin, such as liver problems, muscle weakness, kidney disease, diabetes, thyroid disorder, or if you're drinking more than 2 alcoholic beverages daily. What are the most common side effects? All drugs can cause side effects, so talk to your doctor or provider if you have the following side effects or any other side effects that bother you or do not go away. GI side effects such as diarrhea, joint pain, muscle pain or tenderness, upset stomach, nose or throat irritation, trouble sleeping, headaches. With my patients, we usually reduce the dose and monitor symptoms for the next couple of weeks to ascertain if the symptoms are dose related. If very severe, we stop the drug altogether to see if the symptoms resolve. Another strategy is use dosing every other day or every other day regimens, and even every other week regimens have been also evaluated as strategies for improving tolerability. So what are serious side effects caused by atorvastatin? Although rare, some people may have very bad and sometimes deadly side effects when taking this drug. Tell your doctor or get medical help right away. If you have any of the following symptoms or signs that may be related to a very bad side effect: signs of an allergic reaction such as rash, hives, wheezing, tightness in the chest or throat, trouble breathing, trouble swallowing or talking, swelling of the mouth, face, lips, tongue or throat. Signs of a UTI, urinary tract infections like blood in the urine, burning or pain while passing urine, feeling very weak or tired, feeling confused, memory problems or memory loss. This drug may also cause muscle pain or tenderness or weakness, and sometimes a very bad muscle problem may happen that may lead to kidney problems. This is a medical condition called rhabdomyolysis, which can, if left untreated, lead to death. Call the doctor right away if you have muscle pain or tenderness or weakness that is not normal. Sometimes deadly liver problems have happened with this drug. Call the doctor right away if you have signs or symptoms of liver problems such as dark urine, feeling tired, not hungry, upset stomach, pain in your stomach area, light colored stools, throwing up, yellow skin or yellow eyes. Can atorvastatin be used in all adults? There is benefit from statin therapy to healthy individuals 75 years of age or above. Statin therapy for these individuals with established cardiovascular disease, that is, having a history of a stroke or mini stroke, also known as TIA, or heart attack in the past. In my older patients, we start at a low dose and titrate carefully, monitoring for side effects. However, the decision whether to treat high cholesterol in an older individual should be individualized based on both chronological age and biological age. But in older adults, there's no clear evidence that high cholesterol leads to heart disease or death. In fact, some studies show the opposite, that older people with the lowest cholesterol levels usually have the highest risk of death. Moreover, all adults with a limited lifespan, multiple comorbidities affecting overall function and cognition, multiple prescription drugs with the potential for drug-drug interactions are probably not good candidates for drug therapy. Ultimately, the decision to initiate or discontinue a statin in an old adult must be individualized. Shared decision making should be taken into account, especially patient preferences, and the benefits versus risks for that individual should be taken into account. So now here's a bonus section. 3 bonus facts. How long after stopping atorvastatin will the muscle pains tend to cease? Usually it's about 4 weeks. Cognitive impairment is also listed as a potential side effect, and as a doctor who specializes in treating old adults, especially with the lack of randomized controlled trials, I do take this list of side effects seriously when reported by my older adults. So can atorvastatin cause increased blood sugar levels? Multiple trials were suggestive of the increased blood glucose levels after long-term statin use. This has prompted the Food and Drug Administration, FDA, to include the risk of diabetes in their product label of statins. So talk to your doctor about whether a statin is the right choice for you given your other medical problems. So question of the day: have you had one of the side effects mentioned in this video, and what did you do about it? Well, go ahead and leave your answers and comments below. Thank you for checking out this channel. Don't forget to like, comment, and smash that subscribe button. If you can't smash it, at least touch it or push it. And if you want to see more videos, you can click up here, or click up here, or click down here, or click here. Have a good day. Come closer. The video's already finished. So what would you rather have? Atorvastatin or this pack of chips?